You are welcome to Dr. Ephraim YouTube channel. We are here with an interesting topic again. We want to discuss about some common mistakes that people make that cause blindness. What I mean by common mistakes, some habits, some actions that we take, some things that we do that can lead to blindness. Number one of the things that we're going to discuss will be instilling harmful substances into the eye in the course of trying to treat the eye in our own way or in a local way. Number two is self-medications, especially eye drops, or indiscriminate use of eye drops. Then number three is lack of what we call REE. REE means routine eye examination. Then number four is not following the guidance or the instruction of your eye doctor. The last of what we are going to discuss today is what our belief system, or our religion. Let me use religion or belief system. First of all, we start with substances that we put in the eye in the course of trying to treat the eye in our own way. With my years of practice, I've seen that a lot of things are being instilled in the eye in the course of trying to treat the eye of infection or some things that are not disturbing us in the eye. Like the common one we know that they call Apollo, which is viral conjunctivitis. People instill some terrible things in the eye. For example, some people use urine, some people use sugar, some people use breast milk, some people use acid, battery acid. Some people put onions, raw onions into their eye. Many things that they put into the eye. Some herbs that they will squeeze out the juice and put in the eye. By the time that patient is coming to the clinic, you, the eye doctor, have nothing to do for the patient. For example, if somebody is using urine to treat the eye of whatever is the problem that the eye is having, whether itching or infection, there is a tendency that that person can go blind. Let me explain well. For example, the person that is instilling that urine into the eye might be suffering from gonorrhea. Then you now take the urine that is infected with gonorrhea to instill into the eye. Automatically you inoculate that eye with gonorrhea. And when that eye is inoculated with gonorrhea, what happens? You have bacterial conjunctivitis. And when you have bacterial conjunctivitis, the eye will start bringing out pus, purulent pus. We call it mucopurulent pus, that will be gumming the eye together when you wake up in the morning. By so doing, you have caused more harm to the eye than trying to treat the eye. How will this bacterial conjunctivitis now cause blindness? The human eye has the black portion that we call the cornea. That black portion that is inside is the iris. But there is something covering that black portion that is called the cornea. Just as you can see in this dummy, there is a white transparent substance covering the front of the black eye. That something is called the cornea. If you are wearing a wristwatch, you see my wristwatch is black inside, but there is a face of the watch that is glass. The glass on the wristwatch. That's how the cornea is looking in front of the eye. That cornea is a very transparent sheet, and it allows light to pass into the eye for us to see. Once that cornea is affected, that patient cannot see again. Light cannot pass through. The patient will go blind. Just like our biblical story where Samson, they put hot knife in front of the eyes of Samson, and Samson immediately got blind. It's because the cornea was affected. The heat destroyed the cornea, so Samson cannot see again. Now, when you put urine into your eye in the course of trying to treat the eye, what you have done to that eye, you have inoculated the eye with bacteria. That bacteria will affect the eye. It will now form what is called bacterial keratitis. Bacterial keratitis means there will be injury on this transparent part of the eye. Then you will not find yourself in the hospital. Once there's an injury that has penetrated the cornea deep down to the level, like the stroma level, That means it's going to leave what we call scar. When that scar comes on the eye, that's what some patients will see and call it cataract. But because it's not cataract, it's looking whitish. It has formed scar because of that infection that you have used your urine to infect the eye. And the doctor has treated it, but the scar is still there. Since that scar is still there, the patient will not be able to see again. So blindness has done what? Has set in. That's when you use urine to treat the eye. Then number 2 of what people put in the eye that can cause blindness is sugar. When you put sugar, sugar is a substance, is a culture for bacteria to strive. When there is a bacterial conjunctivitis or you have a bacterial infection of the eye and you now add sugar to it, you have given food to that bacteria to eat. The bacteria will grow more. When it grows more, it will cause more damage to the eye. So with that, the cornea or the eye will be affected seriously. That can lead to blindness. Some people go to the level of putting fuel or kerosene. Those are hydrocarbons. We know the effect of hydrocarbons on tissues. When you put those strong hydrocarbons that are corrosive, they will cause corrosion on the cornea, thereby leaving wound. Then when there's bacteria around that eye, since there's wound on that cornea, you will have infection in the cornea. When the cornea is infected, treating cornea infection is a serious case in the clinic. You might end up losing the cornea. Then sometimes some of those substances that you put, like acid, some put herbs, some of them can cause this cornea that we are talking about to start melting. When the cornea melts, when the cornea starts melting, what happens? The iris or the iris prolapse, there might be what we call iris prolapse. That means the black eye will start shooting out. So by so doing, you have damaged the eye seriously. So instilling harmful substances into the eye is not good for the eye. It can lead to blindness. If you have Apollo, which is viral conjunctivitis, or even if you have bacterial conjunctivitis, or if you have any problem, allergy, itching, there are drugs, there are eye drops like this, medications like this, that you can use to treat it and the thing will go. So instead of trying to use herbs or native things or substances around you to put in the eye and then try to treat, instead of treating, you are destroying the eye. They are not good. That's number 1. Instilling harmful substances into the eye can lead to what? Blindness. So advise viewers, advise people that have eye problem, whatever eye problem you have, it's advisable to visit the eye clinic and see your eye doctor for proper treatment. Most of the infection, most of the problems you have in the eye, there are eye medications that you can use to treat them, to avert blindness. Because some of those blindness are irreversible. When you destroy your cornea, you might not be able to see again. And the cornea transplants that they do to exchange the cornea is very expensive. It runs in millions. And most of us might not be able to afford it. Instead of coming to the clinic to treat your eye, you try to use kerosene, you try to use sugar, you try to use urine, you try to use breast milk. The lack of breast milk is common with our breastfeeding mothers. Once they see the child bringing out mucus from the eye, they start putting in breast milk. That breast milk is very rich in nutrients. So if that child has bacterial infection on the eye, most time when they give birth to them, because of the birth canal, that's the part that the baby will come out from. They normally use their eyes to pack some of the rubbish, some of the things that you see on that birth canal, bacteria and some other things that can affect the eye. So if that eye was not properly treated when the child came out, the child might come up with mucous discharge, purulent discharge. The next thing that the mother will do is to instill the breast milk into the eye. And once the mother instills that breast milk into the eye, you will see bacteria start growing up. Those bacteria will start feeding on that breast milk to grow bigger. And then they might end up destroying the eye of that child. Then the second problem that can lead to blindness is self-medications of eye drops like this. Indiscriminate use of eye drops can lead to blindness. When you use eye drops that was not recommended by the doctor, you can cause blindness for yourself. Then, in my years of practice, I've noticed that if a patient walks into the clinic and the patient has venous conjunctivitis, that's allergic conjunctivitis, and the doctor prescribes steroid antibiotics combination, the venous conjunctivitis will disappear. Then somebody might now have glaucoma. Maybe the eye is itching the patient. The patient will start using the same steroid that the doctor recommends for the other person that does not have glaucoma. So in the course of using those steroids, the pressure will build up. What happened? That patient, instead of treating the eye, it will lead to blindness when the pressure increases because of steroid. So drugs are meant, eye drops are meant for specific problems. There's an eye drop that will help Mr. A, but it will cause blindness for Mr. B. And if you are not aware of the condition of the eye and you are using the eye drop indiscriminately or self-medication, what will happen? You might cause problem that will lead to blindness in the eye. So I will advise you not to buy eye drop you don't know anything about. You'll be instilling in the eye because it helps Mr. A. It might help Mr. A to see, but it will help Mr. B to go blind. So eye drops must be recommended by your eye doctor before you use. If they are not recommended, please don't use because it might cause blindness for you. Then the third problem again that patients have is that they don't come for REE. REE means routine eye examination. Routine eye examination can avert blindness, especially the ones that are irreversible, like their big brother that is called glaucoma. It's only when you come for REE that glaucoma can be discovered, because glaucoma has no symptoms, no side effects, and it's called the theft of sight. That will be another topic that we're going to discuss. But when you don't come for routine eye examination, there are some problems. Some of them even pose threats to life. For example, a child that has eye cancer, that we can call retinoblastoma, that has eye cancer, if that eye cancer is not discovered on time, it can cause death, not only blinding the eye, but that child can die. There are some eye conditions, some systemic problems that a good eye doctor can discover from the eye that can save life. So coming for routine eye examination can help blindness, can save a patient from going blind, and it can equally save the patient's life. But if you don't come for routine eye examination, what happens? You might not know that you have a serious problem in the eye. That's why some patient will come with, maybe my glasses is broken or my eye is itching me. When the patient is struggling to treat the common allergy, the doctor is telling him that, look, my friend, that this one you came with is a small matter, that you have a bigger problem at the back of your eye. Because the doctor has done his fundoscopy, he has discovered that you have some more serious problem than what you came with. So that's the power of routine eye examination. If you check 90% of the population, most of them have never visited an eye clinic because they only come to the clinic when the eye stops seeing. No, you should not wait until the eye stops seeing. You must give your eye services by checking the eye routinely. Because the human eye is just like a nylon that you put water inside. It's different from the hand or the teeth or the ear. Once there is a problem and you don't address it on time, that person can do what? Can go blind. And most of the blinding diseases that will come when they don't give you complaint, like glaucoma, they are irreversible. Then another problem that can lead to blindness is our belief system. Our what? Our religion is causing a lot of problem in healthcare, not even the eye alone. A patient will walk into the clinic, after checking the patient, you will tell the patient that you have glaucoma. The patient will say, God forbid, it's not my portion. No, you can't say God forbid it's not your portion. That's what the doctor is seeing and he's telling you. You will tell somebody that, look, you have diabetes and it's affecting the eye. You say, God forbid, it's not in my lineage. That I'm a child of God, I can't have diabetes. No, that's not true. You will have hypertension. I'll be telling you that this hypertension can affect the eye. The patient will tell you that, God forbid, that is not my belief, it's not my portion. So our belief system should not be a problem or something that will deter us or prevent us from treating any eye condition or any other disease we have in our body. Let me shock you. Science is another way of authenticating God's miracle. For example, some men of God will tell you to go and get doctor's reports, or you should come with doctor's reports that you are having so and so sickness. Then after praying for you, if that sickness disappears, they'll say go back to the hospital to do that same test. You will go back, it might be HIV, you go back, they say the HIV is not there. So science cannot be separated with the handiwork of God because it's a way to authenticate God's supremacy over man. Then religion makes us sometimes, when they tell you that you have to use this eye drop, you say, no, my religion says I should not use eye drop. I respect your religion, but problems in the eye should be taken with, we should take serious care of it. We should use our eye drop or use whatever they ask you to use so that the eye will not go blind. So our belief system can equally be a problem of making somebody go blind. Then the last and all of it is not following the doctor's guidance. The guideline stipulated by your doctor, the instructions given to you by the doctor. If an eye drop is given to you and you are asked to use the eye drop 3 times a day for 1 week, and then reduce it 2 times a day for 1 week, that's you are tapering, you are reducing the dosage as you go. You must follow it that way that the doctor asks you to do it. If you are asked to finish the content of the eye drop, you have to finish it. Then if people that are glaucoma patients that are asked to use their eye drop continuously, you don't use your eye drop today, tomorrow you will not use, in 3 days you will not use. When you don't use the eye drop the way the doctor asks you to use, or the medication the way you are supposed to use it, then you put the eye at risk. There are some drugs that when you use and stop, the eye turns red. For example, when you use drugs that contain steroid and you stop, the eye will become very red. You will come back and tell the doctor that the eye drop is not working. No, the eye drop is working, but you did not follow the instruction given to you by the doctor. So you now suffer from what is called steroid withdrawal. The eye will become red. Or you are a glaucoma patient, you are given Zalatan to be using once every night. You will not use the eye drop. You will use today, you will not use tomorrow. Or the eye drop will finish, you will not buy another one. Once the eye drop finishes and you don't buy another one, the pressure will increase more than it was there before you met the doctor. By so doing, you put the eye into serious danger. That blindness that you are running away will not come, even though you are using the eye drop. So following the doctor's guidance, using the drugs the way the doctor asks you to use it, can equally save the eye from going blind. With all these informations I've given, if you can follow them systematically, with that we can chase and kick away blindness in our environment. If you have enjoyed this little lecture or this little briefing, I will want you to give us a thumb up and then smash the like button and equally subscribe, because we'll come up with more videos. Then like and share to others so that other people can benefit from this good gospel that we are preaching concerning the eye, so that blindness will be reduced in our environment.